Chang. I'm one of the directors and the secretary for St. Porter Ranch. I've lived up here with my family since 1991, and I live in the Highlands, which is right there on the edge of our development. So I got involved, and I did a lot of research because I really didn't know what was going on in the hills behind us. So I found there are more than 250 oil and gas wells in the hills behind us. That's according to the Dogger map that we had up earlier. And there's actually no requirement to disclose this when purchasing our new house in Porter Ranch Highlands, and thus no disclosures were made of the oil and gas drilling. Now, there was a disclosure made of the gas storage facility, but again, not of the oil and gas drilling. Okay, next slide. Okay, so this is the map again. And actually, when you all came in, you got a handout, and that's from Catherine Gallows. She's an MD. And that is some information about drilling and fracking and the impacts on the environment. So I hope you got that flyer as you came in. Okay, so let's move to the next one. Next slide. Okay, so regulation. So I thought, well, surely there's government agencies regulating and watching and right on top of this, right? Well, wrong. The EPA's current regulations for oil and gas sector do not directly regulate the toxic pollution coming out of the oil and the gas wells, or set necessary protection for people living near them. So oil and gas wells, as you can see, there's a lot of pollutants that come off of there. I'm not going to read all of them. Benzene, which causes which is a carcinogen. Toluene causes neurological dysfunction. Next slide. Mercury, a neurotoxin, and the list goes on. And this is oil and gas wells and their equipment. So there's a lot going up out there on the hills behind us. So there's been significant research that provides significant support for the determination that oil and gas wells pose more than a negligible risk to public health. So next slide. So air testing. I had to change this PowerPoint because originally when I would give it, I would say the air quality has never been tested in Porter Ranch. But October 23rd changed all that. We all started smelling mercaptan from the natural gas. And so there is some air testing going on, but here's the challenges. So CalGas is testing the air, but they do no testing between 10 p.m. and 6 a.m. And if you've been out walking the dog or you get up early, that's when we really smell the mercaptan, for one thing, and that's also when any of the chemicals are at their strongest. So, we're not getting some of the air quality testing at the times that we really need it tested. Next slide. So in comes South Coast Air Quality Management District. Now, they came out because residents like you started calling October 23rd, 24th, 25th, because we had this horrible smell of natural gas. And so they came out, they're staffed by really wonderful people. They're hardworking. They will come out at midnight. They're very responsive. They do their air testing, but the challenge here is they're anywhere from 40 to 90 minutes away from Porter Ranch. They don't have any employees living in Porter Ranch. And so they come out, we're smelling it really strong, they come out, the wind has changed, and we don't smell it anymore, and they can't get a really good air quality testing because the wind has shifted. So that's been a really big challenge. Again, they're doing the best they can, but that time lag is a big challenge for us to get really good quality air testing. So next slide. Okay, so most recently, there's a lot of chemicals up there that we don't smell, but most recently I think we've all smelled the odorant added to natural gas. It's called methyl mercaptan. So CalGas said it poses no danger, yet I think we know otherwise. This is from the CDC's website. Other possible side effects include headache, dizziness, tremors, seizures, nausea, vomiting, lack of coordination. How many people have experienced some of those in the last few weeks? Yeah, a lot of us have. So those are the short-term effects. Well, what about the long-term effects? This is from the CDC website. We do not know whether long-term exposure to low levels of methyl mercaptan can result in harmful health effects. So CalGas is giving us all of these air measurements, but they're looking for this really high toxic level that OSHA says, oh, that's unhealthy. But what about the lower levels? We're exposed to this day after day after day. Methyl mercaptan is designed to be smelled so that there's a gas leak. You call the gas company, you get out of the house, it gets fixed. We're in an unusual situation here. We're next to this giant storage facility, and we're smelling it day after day after day. And again, we don't know the long-term exposure effects to your health. So that's a real concern of ours. So next slide. So that's why St. Porter Ranch, in conjunction with some of our collaborators that are going to speak today, we're going to be doing our own air testing. So we need some donation of funds. It's going to be done scientifically. We have Sue Chang, she's going to come up and talk to us about how it's going to be done, sent to a lab. And this air testing is going to be done by us, our volunteers in our neighborhoods, at various hours of the day and nights, at various locations, over a long period of time to catch seasonal variations, because we know that the wind and all sorts of things impacts where the chemicals go. We had on next door Porter Ranch, we have a lot of people that go on there. Hey, I'm walking my dog, it's 3 in the morning, the gas smells really bad. We have a lot of people up during that 24-hour period. So between all of us, I think we could take really good air samples. So I think that's what, as a community we need to do. So, the air, next slide. So yeah, the air quality in our neighborhood may contain hazardous chemicals, and until we test samples using scientific methods, we'll never know the amounts, and we'll not know the long-term exposures. And so, unlike mercaptan, which is the odorant added to natural gas, most chemicals are odorless and cannot be detected any other way other than these air samples that we want to be taking. So to summarize, we can make the oil and gas wells responsible for the emissions. Next slide, please, under summary. We've got to be on them. We've got to let them know that we're watching, that we're testing, that we care about the air. We're in an elementary school here. They had to shut down Friday, I believe, when the gas company said there was some oil plume that came out into the air. So we're really concerned here. This is not impacting just us, it's impacting our kids, our health, all sorts of things. So what you can do, number one, be a volunteer for the air quality testing. And I believe the sign-up sheet is in the back. Do we want to start passing that around? Number two, be a volunteer for our health survey. We're going to go around and take a more scientific health survey so we can match the chemicals in the air with the health impacts that our community is suffering. So you put those two together, it's pretty conclusive evidence. You can't do one without the other. And number three, provide any funds that you can to help us get the money that we need to do this scientifically and to get, to pay for the lab results, to pay for the lab analysis. So thank you very much. We're going to have Walker come up for a minute. And we have a lot of these handouts. A lot of people didn't know who to call when they smell the mercaptan, the gas, okay? And you call 1-800-CUT-SMOG. We have all of these handouts here. We're going to do something something fun to remind you about what to do when you smell something. So, Walker, take it away.
Whatever. This is really easy. It's just a simple call and response, and we're actually borrowing the slogan from the South Coast Air Quality Management District. So it's smell something, say something. Smell something?
Say something!
Who do we call? 1-800-CUT-SMOG. Let's say that together. 1-800-CUT-SMOG. If you smell something in your home or in your community, please. 1-800-CUT-SMOG. Smell something.
Say something!
All right, so I guess we're going to have a brief Q&A. We're also going to have a longer Q&A later because we're going to have Sue Chang and Jessica come up. But we just want to give about 10 minutes for a Q&A. We'll try to answer your questions the best we can. Yes?
So after you do the air quality testing and health survey of people, how do you think SoCal Gas is going to respond to that? Because they're a huge company, they have lots of money, they have big attorneys,
They do.
How do you think they're going to respond to that?
You're right. Well, probably not real well, but we have... Is anybody here from Mitch Englander's office? Our LA County Supervisor? Is anybody here from Michael Antonovich's office, our County Supervisor? Okay, well, we have to go that route. We have to get them involved. We'll take it to the county. We'll take it to the city. We'll take it to the press. And, yeah, it's a battle. But I think when we have this scientific evidence... I think they're going to have to step up to the plate. And it is. It's a long-term thing, but you're all here, and I thank you for that. And we're in this for the long run because this is our neighborhood. Those wells up there are aging and old, and this is probably not the first leak. That's probably not the first oops that's going to happen. So we're going to be on them. We have a lot of media here today and a lot of you here today. Does that answer your question the best I can?
Yeah, thank you.
All right, thank you. So Michelle?
Yeah, I don't have a question, but I just wanted to point out, for those of you that weren't at the neighborhood council meeting last Wednesday, I did ask the gas company how long to take to inspect the other 120 active gas wells.
Yes.
They said it's going to take them 6 to 7 years to do that, which just wanted to let you guys know that. That sounds unacceptable, I think, to all of us. But you need to let them know that. You need to let our city and county officials know how you feel about that, because nothing's going to change if we don't all speak up. So just want to let you know.
Right, yeah, so for those of you who didn't hear, it's going to take them 6 to 7 years to assess each one of those wells. You know, because they're breaking down, they're cracking, all of that kind of thing. And that really isn't acceptable to us. So you can go on your city councilman's website and email him directly, same with Antonovich. And, you know, and we'll have some more, we're probably going to have these forums quarterly and kind of strategize about, okay, how do we let them know about that? Can we sign another petition? Can we, because SoCal Gas has a lot of money, and that is an unacceptable period of time. I think I saw you, sir.
Right, SoCal has a lot of money. Why don't you request them to put in permanent testing sites to constantly monitor the air and keep it as a public record?
Yes.
Yes. Many of your people out to do it on their own. First thing they're going to say is parameters, they don't know what they're doing.
Right.
If you force them to do it and keep it as a public record, you have a chance of getting the thing on a long-term basis.
Right, that's one of the demands Safe Porter Ranch submitted to SoCal Gas Company, to have constantly monitoring and a website where we could go to constantly see the air quality, maybe even an app that we could see what the air quality is, because, you know, there's kids here in recess. We got to know what's going on in the air because, you know, this isn't cutting it. Oh, they have not responded to me yet, but we will keep going and going and going. I'm sorry, who is next? Yes.
Campaign contributions amount to bribery, and that's why elected officials have not been responsive to the community. Yes. So we need to bring a lawsuit. R.L. Miller, who is head of the Climate Hawks and the Environmental Caucus for the her party, is willing to bring a class action. People can consult individual lawyers and discuss your cases. It's terribly important that you document your illnesses. If you're getting an asthmatic attack or hay fever or whatever, go to the doctor, get it documented, and make sure that we can bring actions, that we have standing to bring these actions. And I suggest that we contact R.O. Miller, since she is willing to go to bat for it.
Yeah, as Alex here, I believe we got an email from that person, so we're going to be on that. Thank you.
The county health department sent a representative to your last meeting who admitted that they don't know about the health aspects and
Right.
how it can impact us terribly. And it can. They are not denying it. They know that that can happen.
Yeah.
And we need to prevent this not only now, but in the future.
Absolutely.
My son Bobby died of the rarest brain cancer that is always fatal. And I think because of the Santa Susana lab, Rocketdyne, which was done in secret.
Oh,
All
yeah.
of these things were done in secret. Protect your children, talk to attorneys, let's get hold of R.O. Miller and see what and then we'll see some action.
Absolutely, thank you. I'm going to pass this around. This is like an informal brief health survey if you want to fill in. We did this at Porter Ranch Neighborhood Council. And we're going to have more Q&A a little later. We want to keep this moving. So next is Sue Chang, and she's from Pollution Prevention Director. She's a Pollution Prevention Director. Sue is leading the Center for Environmental Healthy Agency campaign in California. She is collaborating with Global Community Monitor on a project to empower grassroots communities like ours, fighting oil and gas development by training them how to monitor and document air pollutants in the neighborhood. She is also educating and engaging public health and medical professionals in California around the health risks of fracking and oil and gas development, with the goal of enlisting them to become advocates for clean energy solutions. For over 7 years, Sue managed CEH's work to create market incentives for the electronics industry to design, manufacture, and dispose of their products in a way that protects public and health environment. Sue has over 2 decades of experience in the environmental health field and has worked with a variety of organizations, including as a consultant to the San Francisco Foundation's Environmental Health and Justice Initiative, as a community health advocate at Green Action for Health and Environmental Justice. Sue received a BA degree in environmental science from Barnard College, Columbia University, and completed a double master's program at University of California, Berkeley's Goldman School of Public Policy and Graduate School of Public Health, where she was a recipient of the prestigious Switzer Environmental Fellowship. So join me in welcoming Sue Chen.